Hello everyone. Continuing with health education and community pharmacy subject. The first topic, concept of health. So till now we have covered the definitions, the other aspect of health, factors affecting health, factors promoting health, indicators of health, concept of disease, in that natural history of disease, and classification of disease agents. So these are the contents, and in this content, the last part of the chapter is concept of prevention of diseases. So that we are going to cover today, and with that, the first chapter will get over. Now, the last part is concept of prevention of disease. We know health, we know disease. So how the diseases are to be prevented in this last part that we are going to cover. Now as it is said, prevention is better than cure. You might be knowing, according to this saying, preventive measures must be taken for occurrence and spread of disease. So, by preventive measures, the occurrence and spread of disease can be blocked. Now, factors that are harmful to health must be taken care. We must identify the factors which are harmful to our health, isn't it? So that we are going to cover nowadays. Now, the concept of prevention is broad based and it is defined in three levels that we will see today. Now, three levels are primary prevention, secondary prevention, and tertiary prevention. So, the general question is asked on concept of prevention of disease, and we have to explain this at three levels, and all these three levels have their own definition. So that we will cover today. Now, first level is primary prevention. Now, the meaning of primary prevention or definition is that action taken prior to the onset of disease. Action taken prior to the onset of disease. That means start of the disease, which removes the possibility of ever occurrence of disease, or which removes the possibility that a disease will occur. Once again, I repeat the meaning of primary prevention: action taken prior to the onset of disease, which removes the possibility of ever occurrence of disease. Now, the action, what type of action is to be taken in primary level? So, the action means the measures that are to be followed which will increase the standard of living. The standard of living can be increased and general well being can be promoted. Now, how these factors can be followed, that we will see now. They are followed at in two steps. First is health promotion measures, we can say, and other are specific protective measures, or we can say health promotion and specific promotion, isn't it? Now, health promotion, these are the general measures. What measures are taken under health promotion? As it is displayed: health education, environmental modification, nutritional intervention, lifestyle and behavioral changes. Now, in this, the health education. So, we must know the healthy ways of living, isn't it? Like maintenance of healthy ways of living in daily life, isn't it? Now, what are the healthy ways of living? First of all, healthy environment, maintenance of healthy environment. Then personal hygiene, taking care of hygiene. We have studied in very first lecture about the personal hygiene. So here personal hygiene and environmental hygiene, that both will come under health promotion measures. Then eating well balanced diet, taking adequate food, taking safe drinking water. Then we must have provision of proper disposal of waste matter, disposal of excreta, and whatever the waste matter is there. Then provision of well managed sewer system, isn't it? Now, if you are not understanding any term, so that you may find out online, you have Android mobile handsets, so you may have Google search also, you will get the idea about these terms. Then isolation of infected person. If a person is suffering from any infection in family, so that person must be isolated. Like as we know nowadays, social distancing and face mask we are using against corona. So in infections also, isolation, that is separation, is very important, isn't it? Then lifestyle habits. Now, lifestyle habits are very important in our day to day life, isn't it? So, avoiding any bad habit. Then, on the same time, we must motivate the people to avoid use of tobacco, alcohol, and drugs, isn't it? And if any lifestyle habit, if it is wrong, if it is affecting our health, so that must be changed, isn't it? And nutritional intervention, as I gave you the idea, taking well balanced diet, isn't it? Now, the other step is following specific protective measures, isn't it? Now, some of the diseases can be prevented by specific protective measures. For example, there are certain infections like tuberculosis, diphtheria, pertussis, tetanus, polio, measles. So, they are prevented by immunization, Tikakaran, Lassikaran, what you know, that is called immunization. Now, this immunization is done at a proper age and time, isn't it? You might be knowing that small children are vaccinated, isn't it, at a particular age group. So, by these vaccines, those children are protected from infections throughout their life, isn't it? Now, apart from vaccination, you might be knowing that the whatever the primary healthcare centers are there, so they provide the doses of vitamin D and vitamin C also. So by giving the adequate doses of vitamin, whatever the vitamin deficiencies are there, those can be prevented in the life. Like vitamin D is given to prevent rickettsia. Vitamin C is given to prevent the person or child suffering from scurvy, isn't it? So, vitamin C, vitamin D, and all other vitamins are also important. So, that will come under specific protective measure. Which are the other specific protective measures? Like industrial accidents can be prevented by using devices like goggles, gloves, or protective shields, isn't it? Now, what these goggles, gloves will do, they will provide protect the person from carcinogens, from allergens, or if any occupational hazard is there. So that can be prevented. So in your screen also specific protection includes immunization as we have discussed, isn't it? Then specific nutrients like iron. So as I gave you example of vitamins D and C. So here iron is there. So iron tablets are given to prevent the anemia in the persons, then protection against injuries, as I said, that use of the goggles, gloves, isn't it? Then chemoprophylaxis, that means against malaria, isn't it? Then control of consumer products, quality and safety of foods, drugs, cosmetics. So that will comes under specific protective measures, isn't it? Now you know about the countries like Western countries, as I said in previous lecture, they are developed countries. So they have succeeded in eliminating, eradicating infectious diseases by following primary prevention. So efforts are being made to prevent chronic diseases by primary prevention, isn't it? So if we follow primary prevention, most of the diseases can be prevented. And primary prevention is less expensive. It is safe and it is more effective way of preventing diseases as compared to secondary and tertiary prevention. So now we will speak about the secondary prevention. First of all, we must know the meaning or definition of secondary prevention. Secondary prevention is defined as action which halts the progress of disease at its incipient stage, or we can say starting stage, initial stage, and prevents complication, further complications. So that is the meaning of secondary prevention. Again I repeat, action that halts the progress of disease at its initial stage and prevents complication. Now although we follow all precautions, isn't it, but still, what happened? The causative factor succeeds in entering inside the body of the host. We have studied this in the natural history of disease, pre-pathogenic phase and pathogenic phase, isn't it? So, although we take so many precautions, but due to climatic change, due to lack of immunity, the causative agent may enter inside our body, isn't it? So, here the number of vaccines have been developed to prevent various diseases, but most of the diseases are there for which there is no vaccine available. Like, say, for example, cancer, diabetes, epilepsy, leprosy, syphilis, malaria, isn't it? So there are no vaccines available. In such cases, what can be done? So in such cases, early diagnosis and treatment is the only solution. Now, the detection of disturbance of homeostatic and compensatory mechanism, while biochemical, morphological and functional changes are still reversible, important in reducing high morbidity and mortality. So these are the advantages of secondary prevention, that it reduces morbidity rate and mortality rate. Now here the secondary prevention, the objective is to arrest the disease process, restore health by seeking out unrecognized disease and treating it before irreversible pathological changes have taken place and reverse communicability of infectious disease, isn't it? So here the aim is to restore health and arrest the disease process, isn't it? As we have seen in the definition, that action that halts the progress of disease at its initial stage and prevent further complication. So by early diagnosis and treatment, this aim is fulfilled, isn't it? Now what will be the another benefit of this secondary prevention? That it will be in the benefit of patient also as well as doctor also. Early diagnosis will help the doctor in preventing the disease with proper treatment and to control further progress of the disease. Also, the suffering of the patient is also minimized. Now, some of the methods by which early diagnosis or identification of disease can be made include screening surveys, periodical examination, and specific examination of people who are at high risk of disease, isn't it? Now, secondary prevention is often more expensive and less effective as compared to primary prevention. We have seen that primary prevention is less expensive and more effective, but secondary prevention becomes little bit more expensive and many times it may be less effective also. So this much description for secondary prevention is sufficient. Then the third level is tertiary prevention. Now, if primary prevention fails, the person gets disease. Then one has to follow secondary prevention. The early diagnosis and proper treatment helps the patient for early recovery. But many times it happens that secondary prevention also fails. Due to typical nature of the disease, it cannot be diagnosed. It cannot be identified at early stage. In such circumstance, if disease is not handled properly or patient is not attended properly, it may lead to various complications which may result in permanent disability or death of the patient. So, in another words, we can say that when primary and secondary prevention fails, there are more chances that the health of the person may get worse. There are more chances of disability, and there are even more chances that the person may die also. That means the risk factor increases when primary and secondary prevention fails. So, in this situation, the tertiary prevention is the third level, isn't it? Now, all measures available to reduce or limit impairment and disabilities, minimize suffering caused by existing departures from good health, and to promote the patient's adjustment to irremediable conditions. So, intervention in late pathogenesis phases to prevent sequelae and limit disability. In short, in simple meaning, I will give you the objective of tertiary prevention. As we have seen the definition for primary prevention and secondary prevention, so you can note down this, that the aim of tertiary prevention is to reduce further complications or permanent disability in the patient. It includes disability prevention and rehabilitation of the patient. This is the meaning of tertiary prevention. Whatever the slide shows, in short, we can say that tertiary prevention includes disability prevention. Disability means apangatva, isn't it? This will prevent the disability, or the tertiary prevention will include the prevention of uh, handicap. The person will not become handicapped. In another simple meaning you can say, and rehabilitation of the patient. Rehabilitation means punarvasan. Now, first part is disability prevention or disability limitation. Now, this can be prevented by immunizing the infants like polio. Now, polio drops are given to the child, isn't it? So, that prevents the polio in the uh, childs in their future life. Now, to prevent or halt the transition of disease process from impairment and handicap, isn't it? Now, impairment means any loss or abnormality of psychological, physiological, or anatomic structure or function. So, impairment is prevented, then disability, that is any restriction or lack of ability to perform activity in the manner considered normal for human being. Then handicap, disadvantage for a given individual resulting from impairment or disability that limits or prevents the fulfillment of a role that is normal for that individual. So this is the meaning of impairment, disability or handicap. These are to be prevented, and this can be prevented by tertiary prevention. So disability can be prevented by immunization, that is vaccination in children's. Then industrial accidents can be prevented by wearing goggles, wearing gloves, hoods. Then many times when the person becomes disabled, so the operations are to be done, surgical operations, isn't it? Then adequate treatment can be provided, physiotherapy can be done to reduce the duration of disability, isn't it? Now the other part of tertiary prevention is, apart from disability prevention, is rehabilitation of the patient. Rehabilitation meaning I gave you, that is punarvasan. Now, the combined and coordinated use of medical, social, educational, and vocational measures for training and retraining the individual to the highest possible level of functional ability. So that is the aim of rehabilitation, that is punarvasan. Now, how the rehabilitation is done? Now, rehabilitation is done of a handicapped person who has become handicapped, who has got certain limitations. So, the rehabilitation of handicapped person is very important, isn't it? And he must be rehabilitated in such a way that he does not feel inferior, he does not feel ignored. He can earn his livelihood and become useful member of the society. Now this can be done through physiotherapy, occupational therapy, vocational. Now these are some of the types that are given on your screen in the slide as it is visible. Medical rehabilitation, that will include physiotherapy, isn't it? Vocational rehabilitation, isn't it? Then social rehabilitation, isn't it? Psychological rehabilitation. So psychological factor is also very important. The person, the handicapped person must not get depressed, isn't it? Then sheltered workshops are there. Then for such patient handicapped persons, there are hostels and schools for handicapped children, isn't it? Then there are certain examples of rehabilitation of patient, like establishing schools for blind. So those who are blind, separate schools are there, isn't it? Isn't it? Then provision of aids for crippled. So the person who is having crippled arm or crippled leg, because of their limitation, isn't it? So provisions are there, isn't it? Now there are so many persons who are not able to hear, isn't it? So such persons, the hearing aids are provided, isn't it? Then exercises in neurological disorders. So most of the persons have got neurological disorders also. In that some exercises are there which can help those persons. Then prosthetic restoration of lost tooth. So there may be some dental disorder also, isn't it? So here requires cooperation from different sections of society. Here the private organizations are there, isn't it? Private groups are there, isn't it? Red Cross Society or other private groups are there, Rotary Club, Rotaract Club, isn't it? So they also play very active and important role, isn't it, in rehabilitation of the persons, such persons, isn't it? So that is all and about the prevention of diseases at three levels we have discussed, that is primary level, secondary level and tertiary level, isn't it? So here this was the last topic in this first chapter, concept of health, isn't it? I hope that this chapter you have understood, you have found these whatever the slides are there useful, isn't it? So if you are not understanding, again I repeat that you must listen the lecture twice or thrice, isn't it? Go through these slides, listen carefully, isn't it? If any meaning if you are not getting, so you can find out the meaning on the net, isn't it? And you have to complete the notes also of this chapter. The separate link for the questions and important answers I will give you, isn't it? And whatever the slides are there, those slides itself are answers for most of the questions also. Thank you.